Posture starts with the proximal hamstrings. Why? Because when we lose proximal hamstring control, our pelvis will fall forward on one or both sides. Once the pelvis falls forward on one or both sides, your back arches, your head and your neck comes forward, and now you have what is classically deemed poor posture. So as I've stated time and time again, the important part is that you need to feel your hamstrings up top towards the proximal attachment, basically up towards your butt, kind of where the gluteal fold is. That's where you need to feel the hamstrings. If you feel the hamstrings closer to your knee or closer in the middle, it's not really where you want it. At the knee, no good. If you feel your calves or quads, no good. You really want to feel it towards your butt. So the first thing you can try doing is just lying on the ground, put your feet on the wall in this 90-90 position. And all you're going to see is I'm just going to pick up my butt. So I'm doing a posterior pelvic tilt of my pelvis, which brings the pelvis back. I'm pulling my heels into the back of my shoes and I'm squeezing the ball with my knees, and I breathe in through my nose and out through my mouth. Concentrating on getting all of the air out, and you just, take note of what you're feeling. Do you feel your hamstrings up by the butt? If not, do you feel one hamstring more easily than the other? Do you feel your right hamstring up by your butt and your left hamstring closer to your knee? Very common, because right now in this position, you're not biasing yourself. You are, even though both feet are being used on the wall, and you're pulling both heels down towards the floor like you're doing a leg curl, but the feet are obviously not moving, and your pelvis is rotated posteriorly. Okay, that's like a half squat position. You should feel your hamstrings. A lot of people will not, and that's the whole point of this video. So you can use this as a test, and if you cannot feel your hamstrings in this position, and I'm going to explain later on why certain people may not feel those hamstrings and what you can how you can approach this issue, then you can try the next technique. This technique is technically more difficult, but I'm showing it because actually I have found this to be hugely helpful for me, and that's a really long explanation. However, you can also do this at the gym. You would not want to load up the weights because there are gym machines that you can keep your back rounded completely, and that's the key. Remember, your back has to stay rounded as you do a leg curl. So I wouldn't load it up, but if you are strength training and you want to load up your hamstrings, doing it on a machine that will allow your body, your torso, to stay in that flexed position rather than arching your back is a huge part of all this. So in this position, what you see is I got a lot of pillows supporting me to help keep my back rounded. Otherwise, it's very, very difficult. And this is why a lot of people who do PRI therapists, probably don't use this technique a lot, because it's hard. It's going to be hard for people to understand how not to arch their backs. But you're going to see the difference between a back staying rounded. Now, I have a pretty deep curve, so you might say, oh no, you still have a curve in your back. I don't. I'm in thoracic flexion. I am not extended. My back is not arched. If I were in that position, I would not feel my hamstrings and I would not feel my glute medius, which I do feel during this technique. So this is what it looks like. You'll notice I also have a pillow underneath, a rolled up towel underneath my knees for my knees to push down into. So my back is staying completely rounded. I'm also, with my arms, I'm actually pushing my arms into the floor a little bit to help push my spine towards the ceiling, which will also help me keep my back rounded. Because I need my pelvis and my rib cage in front to be closer together. Because remember, most people are living like this. This extended lumbar position is the origin of poor posture. To reverse that, and all the pain that PRI is dealing with, that PRI is trying to help people with, to reverse that, you have to bring your ribs and pelvis in front. You have to shut that door in front and then learn how to access your hamstrings in that position so the hamstrings can learn how to pull that pelvis backwards. This will also keep your lower back extensors out of the picture. If you arch your back, your lower back extensors and your hamstrings oppose each other. They can't really work optimally at the same time. If anything, they're just going to get caught in a tug of war and you're not going to really have any benefit whatsoever. So this is the technique. It's pretty simple. You just see me, I'm just trying to get in a position to round my back better. And then I just start to bend my knees and I have a band around my thighs above my knee and a band around my ankles. And I am flexing my knees, my pelvis is in an extended state. Now this is what it would look like if it was wrong. You're going to see my back arch. That's wrong. That's what you cannot do. And that's the issue. If your back arches, it's not going to work. But that's how people are living. So obviously your hamstrings are not going to engage and your glutes are not going to engage properly, because right now that pelvis is rotated forward in this picture. In the previous technique, when I was doing it correctly, the pelvis was posteriorly rotated, which is what you need. So with the band, my knees are pushing out against the band a little bit, and then my ankles are also pushing out against the band that's around my ankles, which is putting my femurs into internal rotation. A lot of people who have a pelvis that's forward on both sides, which means their back is arched and their ribs are going to be flared, a lot of them have legs that are living in a state of external rotation. They're not going to get the appropriate hamstring activity if they're living in external rotation. So this technique actually just reverses everything. It takes the pelvis, brings it back, brings the ribs down, gets the femurs into internal rotation, and from there you're learning how to use your hamstrings and theoretically your glute medius in this position, if you can do it, to restabilize yourself. Now, if you struggle with this technique, there's another technique that I've already made a video about on my YouTube channel, but I'm just going to show it quickly again. This, you just see me breathing in this position. And what I'm doing is, again, I'm in a flexed position. And I'm sensing my back moving back into the wall because I need to help reestablish diaphragmatic breathing. I use this with people all the time. It's one of my staples to reinforce a sense of grounding. Again, in this, my pelvis is tilted backwards. My thorax is flexed. And then what I can't do is breathe with my neck. If you see a neck go up, which I'm going to show, oh, there it is. That's what you can't do. That's what we have to prevent from happening. So I have an entire video dedicated to that technique, and you should watch the whole thing. Otherwise, what's the point? If you don't have context for the actual technique, that's meaningless. There's enough meaningless stuff on YouTube. So that technique could be used to help integrate these hamstring techniques. In fact, when people cannot feel their hamstrings, and I know that they're not a cranial patient, and I'm going to show a picture of what that looks like because you'll see a picture of me, and I know that their neck is not too tight, and I'm going to show that also. If that's the case, then I put them in that position first if they cannot feel their hamstrings in either of those positions. And then once they do the technique where they're standing against the wall, they go back to the 90-90 where their feet are on the wall and, oh, I can feel my hamstrings. So if you can't feel your proximal hamstrings and you don't have a cranial issue, again, you may not know whether you do or not, and your neck is relatively relaxed and you may or may not have a relaxed neck, you're not going to know. That's why I always encourage people to see a PRI therapist who can actually test you. If all that is okay, you're just not grounded. Your brain, you're just struggling to diaphragmatically breathe because you're probably pulling your neck up when you breathe or arching your back and you don't even realize it. So all those techniques taken together are to reestablish appropriate pelvis position, pulling the pelvis back into a neutral position, pulling your rib cage down in front with your abdominals, your internal obliques and transverse abdominis, so you can expand your back with air. That's the key. If you cannot expand your back with air as you breathe in, you're going to pull the air in with your neck and your lower back, and now you just get stuck in this state of extension, aka poor posture. What else might you see? Well, if you look at this individual, how big his left lower back is, that left lower back is stabilizing his left pelvis. Remember, the left side's the weaker, inherently weaker side. It's our non-dominant side. It's got the smaller diaphragm. We have less muscle over there. So his left, if I see a left lower back like that, I know that left lower back has taken place of his left abdominals, has taken place of his left diaphragm, and has taken place of his left hamstring and adductors and glutes. He is all left lower back, and that left lower back is doing his breathing and his stabilization on that left side. Someone who can't raise their arms up over their head without pulling their neck forward. Very normal. Why? Their ribs are up in the front. Their pelvis is tilted forward on both sides, so they're extended. And if you're extended and you lift your arms up, again, your shoulder blades, your scapulas, which are raising those arms, are not stable, so you're overusing your neck to actually use your arms, and that pulls your head and neck forward. And oh, that's me from probably about 15 years ago. You can see my left ear is higher. As I bring those arms up, it's pulling my head down and to the right. You see it all the time. This is a very typical neck test. What I'm doing is I'm testing this individual's ability for the neck to side bend through the mid-neck. Someone who is lacking pelvic stability and lacking sense of the ground. I know a lot of people who wear minimalist shoes, are in this position. I'm not saying everyone. It's just the people that come to see me, if they're wearing minimalist shoes, they think they're grounded, but they're not because their necks do not side bend. Put them in a different pair of shoes, and all of a sudden they have better neck range of motion. So in the picture on the left, he's very limited. In the picture on the right, he has much more lateral flexion, which means he now has the ability to reground himself and stabilize his pelvis. If his neck does not side bend, it's going to be difficult for him to establish proximal hamstring control, because that overactive neck, because his neck is forward, is pulling his rib cage up. The rib cage gets pulled up in front, which arches his back, pushes his pelvis forward, and again, he loses proximal hamstring stability. People who cannot diaphragmatically breathe. But remember, if your pelvis is forward on one or both sides, you're going to have overactive hip flexors keeping that pelvis forward. Here's the issue. Those hip flexors, including the psoas, are contiguous with the diaphragms. So that's why, again, stretching the psoas literally does nothing, because if the diaphragms aren't pumping his breathing muscles, it's not going to change anything long term. The only way you're going to inhibit psoas muscles or hip flexors, get them to shut down and relax, is to get diaphragmatic breathing back in your life, because you can't separate the two. So if the diaphragms are not pumping, the psoases are not working the way they're supposed to work. They're going to be overactive, holding that pelvis forward. And again, the rib cage is going to come up and you're stuck back into that extension pattern. All of these techniques that I just showed could be considered psoas inhibition techniques, or they could be considered diaphragmatic breathing techniques, or they could be called proximal hamstring techniques. It all has to go together at the same time. Or you could call them neck inhibition techniques, because that neck might relax immediately the moment you do one of these techniques, or it may not. It depends on the person. And for people who don't understand posture restoration, they watch one of my videos, sometimes they get upset that there's no one stretch or one exercise or one technique for every single person. That's because we're all individuals. If you look at my changing face over time, you look at it was probably around 1992, you can see how asymmetrical my face is. And it's not just because of the position that my head is in when the camera's being taken, when the picture's being taken. You can see my left eye is significantly higher than my right eye. And that persists, in my left ear is significantly higher than my right ear. That's because my head was down on the right and my face was already torqued. My cranium was already torqued. Literally, the right side of my head was collapsing, and you can actually see this. You can see the difference. Even in 2018, I was still in that position because I still was not feeling that great. Although most of my chronic pain was gone, I still had other issues. But now in 2023, you can see my head is much straighter. It's kind of straightened out and it's widened. And that's the important part. My cranium literally expanded. My forehead is wider. My face is wider and things are more symmetrical, which is good. When I see a face like that, I know they're going to struggle with their proximal hamstring. That's why I care about the cranium so much. I care about asymmetry, not because I care about asymmetry. Everyone's going to be a little asymmetrical. But I get concerned because I know what the asymmetry can actually imply. That is an ungrounded cranium that you see. I don't think I was ever grounded. That was an ungrounded cranium. And the osteopaths and the cranial sacral, so osteopathic doctors who go to medical school, so people who if someone watches this video and says, oh, doctors, this is not real, it's real. Osteopaths would know this, and cranial sacral therapists know this. Your health starts with the cranium. Posture restoration will not struggle. No. Posture restoration, typical posture restoration techniques that you may see for the hamstring or the adductors or for the abs, for the glutes, to restore that pelvic stability, to restore diaphragmatic breathing so you can expand a rib cage. When you have major asymmetry in the cranium because of the effect on the neck that pulls you into extension, that's the issue. When you have a dental issue, a visual issue, hearing. These are all the things that your brain uses to figure out where you are in space. Your brain does not give a crap about lifting weights. It does care about where am I located in space so I can move appropriately. Where am I? Your brain does not know where you are inherently without effective sensory input. And when I see craniums that are twisted or very asymmetric, I know there's probably some sort of asymmetry going on in terms of sensory processing. That's me. That was my life. My lower body and all my chronic pain had nothing to do with my lower body. My SI joint issues, my shin splints, my plantar fasciitis, my neck spasms, my hip pain, my general lower back pain, the ringing in my ears, all that crap. None of it had to do with my lower body. It was all because of sensory processing and breathing. So if someone's in my position, you're going to struggle with feeling your proximal hamstrings. If you don't have any cranial issues and your teeth are fine, your vision's fine, you probably won't have problems feeling your proximal hamstrings with proper guidance. And that's the important thing. If you're going to try to do it on your own, well, it might not work too well because there's a lot of nuance that goes into this with the testing and what's going on with the rib cage. But if you don't have any cranial issues or visual, jaw, teeth, it works really well as long as you have proper guidance.